It is the 23rd of June today, and what time is it? It's 9:15. And this day last year was the final day of university. And I'm going to get into this video what I've got up to in the past year and what opportunities have came my way in this past year since finishing university. So when I was a student, I was making videos for TikTok. I was creating certain types of videos related to my profession, which is podiatry. And of course, that gave me the confidence to be able to kind of make videos and showcase my skills. But these were skills that I was learning. Obviously, these weren't skills that I had on lock. But I felt like if I learnt them, then taught them, then I can kind of solidify that skill. And it really, really helped me optimize all my skills within podiatry, which has been fantastic. Of course, creating content is something that I've always loved to do. Since a young kid, I'm a skateboarder and I used to make skate videos with my friends. And that's what I kind of did with podiatry. I wanted to kind of bring my creative edge into podiatry, which is something I'm trying to do now. So I tried to use my communication skills, which I learned from various jobs, up until this point. And it really, really helped me navigate this space and just talking to people, asking for advice, asking for certain kind of tips and tricks within your profession. It's so helpful. And just talking to people are often really, really quick to help you. So that's what I did. Continually through this year, I've kind of sought advice, I've spoke to experts, and I spoke to a lot of people within my profession. And that's really, really helped me navigate the profession in a professional way, I guess. And it's been really, really helpful for me to be able to get to where I am now. So how did I get to where I am now? So where I am now, as you see behind me, I'm in a private practice. And when I was a student, I was lucky enough to do a private practice placement. And I was lucky enough to kind of know I didn't know a podiatrist, but I knew kind of a podiatry clinic within the area where I was living. So I contacted them and they were happy to take me on. So I did my placement with them. And obviously when I finished university, they said, "Oh, would you like to work here every other week?" And of course, it was really, really handy because the practice owner actually worked for the same trust, Oxford, as I did at the time. And he understood that I have a day off every other week because I work a 9-day fortnight. So it really, really was handy. So every other Monday, I was working in private practice like I am today. So I was really, really lucky to have that opportunity. So firstly, I kind of came out of university and I started working in Oxford as a Band 5 podiatrist. And this was fantastic. It gave me the kind of confidence to be able to build up my skills within a lovely clinic, and it was great. I was based in Biston, Banbury, quite relatively close to where I was living at the time, and it was lovely. The people were amazing, and I really, really learned a lot of skills. However, it got to the point where I was kind of doing a lot of skills that were above my pay grade, and of course, you want to be paid for that. And I know with certain different professions, you need to work up to that, and I understand that. But I thought I might be cheeky and kind of apply for certain roles that may be a little bit above, not my capabilities, but a little bit above kind of my experience level. Obviously coming out of uni 8 months is relatively a short time. But I thought, why not go for some opportunities? I had some advice when I was a student. And, the guy said, take all the opportunities. And even if you're not sure you might get the position, just go for it. You never know what will happen. So around about 8 to 9 months into Oxford, I kind of started to look for Band 6 roles. So Band 6 role, if you don't know, is kind of more of like a seniority. It's like a senior podiatrist, someone who's got a little bit more experience behind them, all the knowledge and the practical skills to be able to back it up. So at the time, I went for a Band 6 podiatry, specialising within MSK, which is kind of to do with musculoskeletal system. So I went to that interview and I had the job of creating a poster on plantar fasciitis, which was kind of my game. I love plantar fasciitis. Obviously I don't have it, but I love treating it, and I feel like it's a really, really fascinating thing to treat. Relatively common as well. And I was in my element. So I created that, made sure it was all good and presented it. I went to the interview open-minded, completely open-minded, and I ended up getting the job. So 8 to 9 months into working as a podiatrist straight out of university, I secured myself a more senior role. So the role I'm doing now is more MSK and also wound care. So I would say like an MSK podiatrist really. So that's my role. And I'm in a very unique trust where this kind of role is just being developed, and I'm getting so many opportunities to work with different professionals. And we also have a podiatric surgery team, which are amazing. It's been fantastic learning from those guys. And it's just been invaluable. So I've gone from a trust which, you know, relatively doesn't have all of those, and it's purely community, to a trust where, you know, they kind of mix together, and the whole team and the teams, you know, different departments like pod surgery, orthopedics, we all kind of like work together and input together as part of an MDT, which is fantastic. The skills that I've learned, so I've gone obviously thrown into the diabetic foot clinic, which has been awesome. It's been amazing. I've got to kind of treat very, very complex wounds, patients with complex needs. I've got to work with orthotics, vascular, orthopedics. I've got to work with pod surgery as well, kind of having days with those guys. So it's just been fantastic. Sorry, I'm going to say fantastic about 20 times in this video, probably even more. Within the last 8 to 9 months, the last 12 months, sorry, I've worked in private practice since I literally left the university. So I've spent 12 months in private practice, and I've also spent 12 months going from my band 5 to band 6, which I feel like is a great progression, and it's been fantastic. Again, fantastic, but it's been brilliant, and I really am truly grateful for the opportunities that I've had. I understand that I am the one who have kind of put myself out there, and I've got these opportunities, and I have to give myself some credit in regarding that. You know, of course, I've had the people around me to help me, you know, and obviously guide me, but if I didn't seek that help, I would have never have been in the position I am now. You know, life is brilliant as well. You know, not only am I really satisfied with work, I'm really satisfied with personal life as well. I've had opportunities where I get to move with my girlfriend in a nice apartment, in a nice place, place in Worcestershire. It's been brilliant, and I've really kind of accelerated this year, and this year has been just truly a blessing, really, you know, coming out of university. So just to give you some context, I did a BSc in sports rehabilitation therapy. So I've worked within sports rehabilitation, and then I did my master's in podiatry. I did a 3-year master's. So normally as a pre-reg, if you go in as a master's, it's 2 years, but I did the 3 years, which was ideal. It gave me the time to process what I was learning and gave me the time to practice my skills. So if I have any advice to give, this is purely just an update video, but if I have any advice to give anyone graduating university, I would say just talk to people, seek advice. Don't be discouraged with the bad advice you get, but also, you know, take everything on board, understand how to navigate the profession, and just speak to people, get advice, put yourself out there, make videos like this. It really gives you confidence. And for anyone considering podiatry, 100% do it, because it really gives you so many options. I could go to Australia, I could go to Dubai, I could go to New Zealand, I could go anywhere in the world, and I know I'll be okay. You know, we need this experience. To be able to have a bigger bag of skills to use is just invaluable, as you know. So yeah, any advice, go and speak to people, put yourself out there, and, you know, try and navigate podiatry, try and navigate any career with an open mind, and just throw yourself into stuff. You know, you never know where it goes. So thanks for listening to me ramble on today. This is no way me flexing at all. I'm just kind of making this video more for myself, really, just to see where I am now, just to check in with myself, and then in a year's time we check back in and see where we are. But yeah, checking out right now, so thank you for listening.